record button, and I am going to welcome Stephanie Kennan to the stage. And Stephanie, I guess I saw some news items out there about your book and tracked you down, and I really appreciate you coming on our discussion. As you all get to know Stephanie, you'll see she's got a really interesting background, and the motivating factors around her writing this book, I think, is real important. But before we dive into the topic of the book, tell us a little bit about your career and what led up to you writing the book, which is called The Family Caregiver, A Survival Guide to Navigating the Healthcare System, Advocating for Your Loved One, and Remembering to Breathe. These book, the publishers now, they really want these long subtitles, don't they?
Steve, I can't hear you.
Oh, you can't hear me. Uh-oh. Let's see. Technical difficulties here. Do you have, my mic is on. You heard me before we jumped on here. Do you have anything plugged into your computer?
I can't hear at all.
Okay, here. All right. Okay.
I heard you in the beginning, and then suddenly it just went. I could see you, but I couldn't hear you.
Okay. Here. Okay, folks, thanks for hanging in there. Let me send her a chat message. Okay. Okay. Do you have, okay, and do you have a mic plugged in? Okay. So folks, while we're working on Stephanie's
it just clicked in.
Oh, you're good? Okay.
Yeah,
you can hear me?
All right. So sorry.
Oh no, that's okay. I always remind people that that period of time that we dealt with a little technical difficulty is a lot quicker than most presentations, where, remember the old days when I would say, and welcome Stephanie to the stage, and then you'd have to walk through the auditorium and we'd be waiting, you know, that was just a minor blip there. So, I gave you this awesome introduction, Stephanie.
I believe you.
And we're excited to learn about your book. But before we dive into the book, tell us a little bit about your background and what led you up to writing this book.
Sure, and I very much appreciate you having me.
Are they just plain color, not all fancified? Okay, I think I'll be up shortly to get them.
I'm getting somebody else talking. So a little bit about me. I've been a healthcare lobbyist for close to 30 years. I've worked for 2 members of the House of Representatives. I've worked in the Senate. I worked for AARP. I worked for the American College of Emergency Physicians. I also worked in the state of Maryland doing health policy. So I have a good understanding of the federal and state and provider and beneficiaries when it comes to policy. I'm an only child, so when my mother became ill, it was me who had to pick up the pieces and figure out how to go on. And what I discovered in interacting with the healthcare system, not as a patient, but as a caregiver, was that there were a lot of things I could understand from a policy perspective, but actually interacting with the healthcare system, again, as a caregiver, was just not what I expected. It was really very different in many ways. And as some of my friends who are also in the healthcare policy world said to me, you had issues. Can you imagine what normal people would have? And along the way, I ended up talking to people who would just be completely confused or afraid to advocate because they didn't want anybody in the system to be mad at them. And I thought, well, when I get through this experience, I'm going to write a book and encourage people to advocate, but to know how to advocate and to also understand that there are some things in the system that are there for a reason.
Great. Yeah. And this is what really struck me when I read the article about you writing this book is that because people have often said to me, it's like, when are we going to get change in the healthcare system? And I'm always saying it's like when politicians start having caregiving issues on their own, it opens their eyes to how challenging the system is. Up to then, it's sort of like, yeah, they're reading letters and stuff like that. And because you were in the middle of policy, but not necessarily a customer, do you agree with that premise? Is that
yes and no. I think there are many times a member of Congress will have a problem and then they'll want to fix it. But I also think that, for example, electronic health records, members thought they passed legislation and everybody would have an electronic health record and it would be easy to pull out of the sky and, you know, life would be much different. And instead the system itself, just because it's a competitive system set up, you know, some people bought this system and some people bought that system and they didn't necessarily talk to each other. I thought it was absurd that I had to have 3 different portals for my mother because she was interacting with 2 different healthcare systems and then one provider who wasn't part of the system at all. So I had to keep track of things and go in and make sure that I knew what each one had said and done so that I had a complete picture, but there was no one complete picture.
That's great. So you had mentioned a little bit earlier about there's some things in the health system that are, you know, they're frustrating, but you just have to deal with it. Did transitioning into becoming a caregiver change your mind on some of those things?
Actually, what I think being a caregiver made me really want to focus on is how communication happens between providers and caregivers. And yes, I think there are some things in the system that could be more efficient. But it really, a lot of my issues really boiled down to how is information communicated and then what do you do with that information? You could give me lab tests all day long. I wouldn't know what was good, what was bad, what was indifferent, but having time to talk to somebody might be helpful to me. I also found, and my mother had a stroke in a hospital that missed the stroke, and ironically, it's certified as a stroke center. And in part, the reason that her stroke happened was because of a lack of communication between the physician and myself. The physician just didn't want to do what I wanted him to do, and I couldn't make him.
Right. This is a common theme on our discussions. Let me back up a little bit because I'm curious about you and your mom's story. So tell us a little bit about the journey. You mentioned you're an only child, and I'll tell you one of our hottest topics on these discussions is solo aging, and you know, the challenges that individuals and families go through, whether you're on your own or you're solo coaching as a caregiver. It can be a real challenging process, but yeah, kind of give us the Cliff Notes version of what happened and some of the different access points that you had to jump into.
Sure. Well, let me start by saying my mother was fiercely independent. She grew up in the Shenandoah Valley, thought the Shenandoah Valley was the most gorgeous place in the world, but she married my father, who said, "Oh yeah, did I tell you I'm planning to go to Europe and not come back?" So she was independent and very brave. My father died when I was 15, so it was just my mother and me for a long time. My mother was really brilliant. As I said, independent, took really good care of herself. She was petrified of ending up like her mother, who had had a stroke at the age of 50 and had a very long decline. My grandmother died at 73. And my mother prepared for her death, but didn't prepare for her decline. And I think that's a significant difference. So we never talked about how she wanted to be cared for if she had a stroke or, you know, a fall, whatever. We talked a lot about what she didn't want in terms of heroic actions and that kind of thing, which was very helpful. And it was a pretty common conversation for us to talk about. She had a trust, she had her living will, she had all the documents you could ever need. But she did not share with me her doctors. She did not share with me her prescriptions. And when she had her first stroke, which was a significant stroke, I was rummaging through her kitchen at 3 a.m. trying to figure out what drugs she was taking, what drugs she wasn't taking. There was a cabinet full of drugs. I figured out who her cardiologist was and kind of went from there. But it was a very long 8-year process. She recovered from that stroke, but it was evident that she could not live alone. She didn't need assisted living. She needed structured, independent living. Plus, I think she would have gone bonkers having somebody come in and do home health care and, you know, chores for her, because she felt she should be doing that herself. So fairly quickly, I had to make some decisions. She was living alone in an apartment in a senior community, but it was all independent. It had no step-down services. I got her into a CCRC. She just made it into the independent living. And it was perfect for her because there was a structure around her. Somebody would notice if she hadn't shown up to eat in a while or that kind of thing. But there were a lot of activities. She never had to leave the building. I had to take her car away from her. That was a very hard event, as I'm sure most people have, when they go through it, realize how hard it is. But over time,
let me get you here, because you're hitting all the hot buttons that our audience members deal with on a regular basis, and these questions come up. So how did you have much resistance when you started talking about, or did she bring up the idea of leaving what I'm assuming is the family home and moving to another place? And you mentioned you just got her in to the life plan communities under the wire. Was there any resistance to those moves?
yes. She didn't want to leave where she was living because she was comfortable and happy there. She couldn't understand that because of Washington, D.C. traffic, if I needed to be at her hospital bedside at 5 p.m. or 5:30, I had to leave downtown at 3:30. She just could not comprehend that. So I finally just sat her down and said, I can't keep driving up 270 in traffic to take care of you. You're not eating well. I know you think you can drive, but you know, she had a couple of minor little accidents that didn't involve anybody else, but driving over curbs and things that ruined her car. You know, all this points to the fact that we need to make some changes, and here are your options. And I laid out, you know, moving to a life plan community, going into assisted living, which she really didn't need, or having someone come in and check on her on a regular basis. And she didn't like the idea of somebody coming in and staring at her. So I did several tours of different facilities and options, took her to some of those, and it was still a no-go. What finally did it was that a friend of mine had a mother in a life plan community and set up lunch for the two of them. And that woman, God bless her, convinced my mother that it would be a good thing for me if she moved. And that was the key.
Well, so really good points here that we see echoed in our dialogue is, number one, connecting with some of the other residents of a community is very important, as opposed to, you know, just interacting with the marketing or the staff, not that they're
Right.
not important. But then the other thing, and this is a theme that I've seen with the proactive individuals that move to life plan communities, they always refer to it as a gift to their children, is that, you know, I'm doing this so that I'm not a burden. And it's usually followed by my what happened with me and my mom and dad, or my
Right.
parents. So that's good. Another hot button that you've talked about is driving. Any sort of tips, or how did your conversation progress there to get your mom? And remember, I mean, these are adults, you know, we can't restrict them like our 17-year-old drivers. How did you manage to transition away from mom driving? Because clearly the safety was a factor there.
Well, initially we made a deal that she would not drive out of her community. And just on the edge of her community was a library, and that was where she really was worried about going. So she one day drove to the library and somehow drove over a curb and did some damage to the bottom of her car. So she couldn't hide it from me because somebody needed to take care of getting the car repaired. And at that point, I was able to sit down and say, look, now my mother was a child of the Depression. She didn't like to spend money in any way, but she really didn't like to spend money on things that she didn't need to spend money on. So I showed her how much she was spending in insurance and gas, which wasn't that much, but it was enough to make her go, oh, I could save some money. And I showed her what her deductible was that we were going to have to pay. And she agreed at that point that when she moved, and we were in the process of moving her to the life plan community, that when she moved to the life plan community, I could take her car away. But it was a very delicate, I understand that this is about your independence, and I understand it's about your need to go places without having to take a cab or me, but let's figure out how we can do this in a way that you can still do things, but you don't need a car. And in fact, the place where she was going to move, they had two conditions. They had to manage her meds because she was becoming, the first drug started a cascade of forgetfulness. And they didn't want her driving. And there were enough activities where she was moving that she wouldn't have to drive for. They had a huge music program, which was really important to her. So it was a gentle pulling back. I couldn't get it back. I couldn't get the car keys from her until we actually moved, but I made sure she didn't have a reason to drive too far.
Yeah, well, thanks for sharing that story. And I think it's you know, it's the tip there is that, you know, we all know our loved ones and what their hot buttons are. And I like how you framed it around the discussion around saving money, because, you know, if that's sort of your loved one's preference, perhaps that can be something that helps open that dialogue. Right. You know, the other thing is that we've had folks share is the safety of children. You know, it's sort of like, look, mom, what if there was a child at that corner when you hit the curb, you know, and sometimes there's a way to pull the heartstrings there. Right. So, okay. Let's see, a couple of questions came in, and we're kind of building to this. Are you willing to share with us, are you still taking care of your mother, especially considering now in the confusing changes that are happening with coronavirus? Is your mother still with us, or?
Sadly, she died shortly after COVID hit. She did not die of COVID, but it made that process and the grieving process even worse, because the last time I saw her was March 13th of last year, when I took her to a dentist appointment. I realized then that she was really slipping, because we got her back to her room and she looked at me and went, oh, that was the dentist. Yes, it's only been 2 hours, but yes, that was the dentist. She turned 90 on April 18th and she died 2 weeks later. And I kind of think it was like her sell-by date. She always said 90 was about as far as she wanted to go. So.
Yeah, it's also scary when we say these things too, you know. I mean, it's sort of like the big statement that is often challenging to most of the families that we talk to is that the parent declares to the whole family, I am never leaving this home. And then, you know, that creates a bunch of complications if life gets in the way. Okay. So great. Thank you for sharing those dialogues. So mom moves into the community. How was life in the community? How did that go?
Well, she came down with shingles the first week she was there. And we all thought it was stress, and it probably was stress. So that was not a great entry. And I had underestimated how hard it is to make new friends at 83 after you've had a stroke. But they had enough programs and interests there that over time, I want to say it probably took about 6 months. She became quite content and quite comfortable and made some really good friends. She had a breakfast group that always met about the same time at breakfast that she really enjoyed. There was a library. She loved to read, so there was plenty of things to read. They have this fabulous music program. And in fact, I was once actually more than once chastised because I made doctor's appointments when there was something in the music program, and she would call me and say I had to change because she wasn't missing the music program. Didn't matter about my schedule. The music program was important. And I think she loved to cook. And in this particular, her particular independent living apartment had a very small, but it had a full kitchen. So she didn't feel like she was giving up everything. But it took a while because I think, as I said, I underestimated how hard it is to make friends when you're 83 and have had a stroke, but she got there.
Yeah. And, you know, like, I think this is one of the things, the challenges with these transitions. I often like compare this transition to a young adult going away to college. And it's sort of, you know, like we can all reflect back on that. And it's that first semester, which is, you know, about 6 months, where we're getting our bearings and this, that, and the other. Now, the difference, as you said, is, you know, okay, if you've lived a long life and you're in your 80s or 90s and you haven't had to make new friends in that long, it's a little bit different than the experience that an 18, 19-year-old goes through. But it sounds like she, you know, really landed on her feet and was really engaged. And if you look at it, I guess you could sort of compare, well, if mom got shingles at home, she wouldn't have the healthcare here and support. And she's certainly not going to have a music program at home that she's, you know, arguing over when I'm scheduling doctor's appointments. So that's kind of cool. Let's see, a question came in from Karen. How long was your mom living at the CCRC Life Plan community?
That's a good question. Let's see. It was 6 years.
Oh, okay. So she had a long-term. Now, did she utilize all the services of the Life Plan community from independent to nursing, or did she?
Well, we skipped over the assisted living because it's ironic. The social worker at her facility and I were having a conversation about, she was becoming a little more confused. She was having issues. She'd go to an exercise class and suddenly couldn't remember how to get back to her apartment. Things like that are signs. And the social worker and I were just starting to talk about how we would approach her about moving into assisted living when she fell and broke her hip and her hip socket and her pelvis. And it was so bad that they didn't want to do surgery on her and pretty much told me she's not going to be around very much longer. Well, they said she was independent. I also should have said she was very tough, because after a week and a half, it became clear she wasn't going to die and the situation was getting worse. So she had to have 2 surgeries. And she never went back to her apartment after that. Her memory really started to go after the fall and after the surgeries. And it was just safer and better to put her in the skilled nursing facility portion of the community. And I want to say one of the advantages of having her in an independent living, even though we skipped over assisted living, is that all the workers knew her, all the nurses knew her. She'd been very active. So going into the long-term care portion wasn't, I think, as much of a wrench as it might have been, because she knew people. Her friends could still come visit her. She was still part of a community.
And again, we've got all different types of people in the audience, and I don't mean this to be, because skilled nursing centers, standalone skilled nursing centers are great resources out there. Mm-hmm. But as a family member visiting too, what I've found is that when family members are visiting mom in the nursing center of a life plan community, there's this, aspect of I'm walking down the hall and I see, I see mom's friends that they can come and visit her. So we hear that from a lot of the folks that we talk to. Yeah. Got a few questions here on some specifics. Someone asks, prepared for her death, but didn't prepare for her long decline in health leading up to death. So complicated yet interesting. Did you know that she had a will and a trust? And did she make her own end of life plans? And did she own a house? Did you know some of these details?
I did know. And I knew that she had a trust. I knew that she had a living will. She was a planner, and when she had her trust done, she showed up at my house with these big notebooks. This was before she had a stroke, and said, "Here's my trust." And I thought, wow, that's a lot of paper for a trust, but apparently it was all necessary. And she had a living will of some form, I want to say, since she was in her 50s. It would be revised every now and then and updated, but I always had copies. And not to be sort of ghoulish about it, she was so terrified that she'd end up in a hospital with all sorts of heroic measures being taken that she used to carry her living will in her purse. Mm. She just didn't want to, and she just wanted to go when it was time to go. So we all had, I had it. I gave copies to my cousins in case something had happened to me. Her power of attorney, everything was done and not a problem. In fact, when she had her first stroke, she was found by some neighbors in her apartment who noticed her newspaper was still on her doorstep, and they went in and called me and called the ambulance. But she had the night before, had put them right on her desk with a note saying, "Stephanie, if you're here, it means you need these documents."
Wow. Well, this is a little bit of a different story than we usually hear. And I know why the person asked that question is because a lot of family members, their loved ones are not as prepared. Your mom right. was actually, probably more precautious in this area, which is not a bad thing, because oftentimes these documents are hidden away and nobody knows where they are. And right. So her paranoia was probably well-founded.
I will tell you that although she had done all of this, and I had the power of attorney and I could move money, I could, make healthcare decisions, her bank would not recognize the power of attorney. And so for several months, I was fishing out her bank statements to see what was in the accounts and trying to figure out how I was going to pay our bills because not very much was done electronically. I called up the attorney who did the trust and said, I don't understand why the bank won't take the power of attorney. And it was a particular bank, which I won't mention, but it is a national bank. And he said that they're notorious for not taking the power of attorney. And here's what you can do. You can pay me a lot of money and I can argue, and it'll probably take 6 months for them to recognize this. Or because your mother is still competent, you can move the money out and put your name on a checking account with hers. And when she dies, the money will go to you anyway. So, you know, in that case, it was lucky to have an only child. There was nobody to fight over anything. And that's what we did. We closed out the account of that bank, went to another bank, and opened up a joint checking and joint savings account that I used to make sure everything got paid.
So I'm sure I'm not sure if we have any attorneys on the discussion, but we've had a lot of this. This is a topic that we talk about a lot. We feature elder law attorneys on a regular basis, and this is a really good reminder for everybody that you can have your documentation done the right way, and an institution might not recognize it, and you did what we'd all do. You go back to the attorney, and when the response is, well, yeah, we gotta, this is what they do, and we gotta fight for this. So that's something I think that had a conversation like that occurred in advance, you know, in a perfect world, you could have made the change to the institution. One thing that I want to recommend to folks, because this is what the attorneys have said to us, is that because you're an only child and you're the only heir, the joint checking account thing is okay. But they really oftentimes caution against, you want to have the financial and the healthcare power of attorney, and that is how an individual is utilizing it, so that can be changed. Because yes, you, Stephanie, you are lucky not to have siblings.
Well, I tell all of my friends when they say they have power of attorney, please go to the bank and make sure they take it first.
Yeah, no, this is good. I've not heard this before. So let's see. A few more really good questions here. Did your mom have long-term care insurance? And how did she finance the life plan community? And this is also one of these things is that, again, folks, we love having these discussions, but we recognize too, as Dixie has thrown into the chat, is that your mom had finances. You know, there's so many people that who fall in between the cracks, or who don't have the income or the accumulation to afford your typical life plan community. But so we'll do talks on affordability and things like that. But out of curiosity, long-term care insurance, and how did she finance the life plan community?
Sure. Well, we sold her house. That helped. And I want to, before I answer specifically, I want to say that I actually went to someone who is completely neutral and said, this particular life care plan community has 4 different options on how to pay for this. What should I do? Because I was so involved and emotional about the decisions, and you know, of course, we'll spend money on my mother, we'll take care of her, whatever. And this person who has a financial background chose the option that I would not have chosen, but it worked. It just goes to show that when you're in the throes of a crisis and having to move fast, or you think you have to move fast, it always helps to go talk to somebody who's got the right background and is not emotionally involved in your decisions. My mother did have long-term care insurance. She had a very old policy that had no deductible, if you can believe that. But it did not cover home health, and it did not cover home health was the sticking point. It wouldn't cover home health.
So it was an older policy.
It was a real old policy.
Okay.
And I tried to figure out how she got it and when she got it. And I think it was when she turned 50, I think she got scared and decided she would buy long-term care insurance just in case. My mother had resources, absolutely. My mother was not a millionaire by any means. And the long-term care didn't kick in until she was actually in the skilled nursing facility portion. And then it was great. It allowed me to actually have enough resources that I could hire additional aides as my mother needed them, as she declined.
And,
So,
you know, that's a good segue to another question that came in. It says, does your book, or can you address ways to hold memory care or skilled nursing staff accountable for appropriate care, and how to address in actionable ways breaches in care? And because you just sort of added in that you were paying for supplemental care in addition to the staff that was there, do you have any words of wisdom in this area?
sure. It's not in the book, but there was a caregiver who flicked water in my mother's face several times, and she was fired for elder abuse. And I think a couple of things. One, where the place where my mother was living really made an effort to have a stable workforce. And that is something I really believe helped the care of my mother, because the CNAs knew my mother's quirks. They were stable. It wasn't like every month you were trying to figure out, when this woman says she wants her, her raisins, what does she mean? It was, these folks knew my mother. And in fact, at one point I went in, my mother read a newspaper every day, and I made the passing comment to one of the CNAs, I'm not sure she's really comprehending what's in the newspaper anymore. And this CNA looked at me and said, oh yes, she is, because she's pointed out 3 articles she thought would be of interest to me, and they were. So it was helpful to have that kind of feedback and know that that kind of stability was there. But I showed up, and I showed up at different times. Wasn't there every day, but I would show up at different times and talk to the caregivers and get their feedback and see what they were doing. And I could tell you who was really careful and who wasn't so careful. And I got to know the leadership of the clinical side, and we talked a lot. There was a time when my mother was with a group that there was a woman, and her form of dementia was to bully people and make up stories about people. And it was very hurtful to my mother, and we moved my mother because of that. So I made sure that the leadership knew I was an involved child, and we had lots of conversations that I don't think, if I had not made my presence known as much, that we would have had. And I think there's nothing like communicating with folks and saying, look, I've noticed my mother is doing more of this, and I don't understand why. Or my mother's upset because she wants to call me in the middle of the day, but she can't remember how to use a phone. What do we do about that?
Yeah, and because you were so involved in the community, again, I'm going to go back to the solo aging topic. You witnessed firsthand how, you're popping in and you're actively involved because you're local, and, you're able to do that. But it's heartbreaking to see the folks that don't have visitors and,
right,
and don't have somebody that's advocating on them on a regular basis. And that's why, we always advise folks, it's sort of like, if possible, if you can, if your loved ones can be in a place that's convenient to you or their network, and you can pop in. And then in the event, and this leads into another question that pops up here, is that if, let's say, mom is out of state, this is where an aging life care manager can be invaluable in terms of, if you can't get there, if you can get somebody else who's knowledgeable, right, and that can advocate.
Right.
And this is the question says, what recommendations do you have for family caregivers who are only children who live out of state from their loved ones and are caring for a mother who doesn't want to do any looking ahead or preparations?
Oh, that's hard. As an only child, if my mother, if my mother were out of state, it would have been a real nightmare because you're trying to do your job and keep your life going and take care of somebody who's not visible to you all the time. I can tell you that I have two friends who are in a similar position, although one of them is not an only child, one is an only child. They essentially initially were going to the neighbors and asking the neighbors, here's my phone number, call me, tell me if you see, anything strange. And when things became more difficult and clearly more support was needed, she did hire a case manager type of person who could check in and help make sure that the right things were going on. And eventually they moved her to an assisted living facility, which she didn't like and didn't want to be there. But over time began to accept that she had to be there. One of my friends had a geriatric psychiatrist visit their parent, and not so much because they thought there were psychiatric issues, but to try to help understand how to communicate, because this parent was declining and didn't want to face reality that they were pretty seriously ill. And that apparently helped both my friend and the parent understand how to communicate a little better and face reality a little bit better.
Great thoughts. A couple of things. Let's see because I was talking about popping in and this, that, and the other. June says, with COVID, visitor restrictions have really impacted families' ability to do that. I totally understand that. But trying to work with the community on ways to schedule that is important.
Right. In fact, my mother was still alive when COVID hit and we couldn't visit, although for me it was a shorter period of time. But doing, Zoom calls and trying to schedule Zoom calls, I think that helped. Although my mother didn't understand the technology and thought I was hiding in a box, and she was pretty upset about it. Why wasn't I coming out of the box? But that helped a lot, particularly as she was declining at those last few weeks.
Karen asks, at what point did you transition from your mom's doctors to those that were at the Life Plan community, or did you do that?
When she went in as independent living, we changed most of her doctors. The only doctor that she didn't want to change was her ophthalmologist. And since she didn't have to see her ophthalmologist more than once a year, I said, okay, I'll keep that. I did a lot of careful research. There were physicians who had office hours at the Life Care community, and there was one in particular that she seemed to really click with, and she turned out to be really a fabulous physician who was very helpful to me at points. I will tell you, my mother, that particular physician stopped having office hours at the where my mother was living, and but her office was very close. My mother changed doctors and then called me up and said, I don't like this other doctor. And I was like, that's okay, we'll work it out, because her office was so close, we could work it out. And a note on this particular physician, when my mother really started to decline and I was really making myself crazy trying to make sure I was there every day and on call 24 hours a day, she said to me, your mother doesn't remember when you were here last. So stop trying to be so hard on yourself and thinking that showing up every day is going to make things better, because it's not. And it's sort of a duh moment, but I needed somebody to say that to me, or I would have driven myself crazy.
I just glanced at the clock and we're getting close to the top of the hour, but you brought something up that I did want to address, that I know that you address in the book, and that is the taking care of yourself as a caregiver. And it sounds like that those words from the doctor were one thing that may have triggered some thought in that area. What guidance do you give to people and where to draw a line in the sand and how to deal with the stress of going through these challenging times?
Well, I think it is imperative that the caregiver take care of themselves. And it sounds so easy to say it, and it's so hard to do. I took up guitar lessons because even if all I did was practice for 15 minutes, I was focused on something else, and the stress in my head would go away. It's, you know, I started going to the gym really regular at an incredibly early hour, but I knew I had to take care of myself. And I will give you a short story. There was a period of 6 months where I was so tired I could not get out of bed on Sundays. I would pull it together to go to work. I would pull it together to see my mother. On Sundays, I just couldn't get out of bed, and I couldn't even watch television. I was so tired. I was a blob. And I was too busy, and I just ignored everything. And every now and then I'd look up why am I so tired? And I came up with 4 different rare cancers and a couple of other rare diseases. I finally called my doctor, went in and said, I'm just exhausted. He took a blood test, called me the next day and said, you're in a diabetic coma. And I said, no, I'm not. I'm perfectly conscious. He's like, no, let me tell you what your blood sugar is, and let me tell you why this is so bad. I had no signs of leading into diabetes, and I had ignored it for 6 months. So, if you don't feel well, take care of yourself. If you need to walk away for a couple of hours, walk away for a couple of hours. But it's imperative, because if I had continued, I'm not sure I would be here right now.
Yeah, and then that really poses some caregiving issues there for your mom. This is a good question. Can Stephanie give a quick listing of the topics covered in her book? Every caregiving book is a little bit different.
Sure. I tried not to be an encyclopedia, and I tried to weave in some of the things that I learned as I went along but I cover the kinds of legal documents you need, the kinds of healthcare information you should have at your fingertips. Some of it's obvious, like what drugs your parent is on. I didn't have that. I cover what is discharge planning when you're in the hospital and they're going to discharge you, how to communicate inside the hospital, not to be afraid to go complain about care that you think is questionable, and how to pick a skilled nursing facility and what the differences are between the different choices you have as you face long-term care, because there are a lot of choices.
That's great. Dixie has a good question. At some point, did you request a do not transport order so she would not be on the medical treadmill in the final weeks or months?
Yes, she had a do not resuscitate, do not transfer. My mother was on hospice twice. She was on hospice for over a year and actually thrived and had to be taken off of hospice because she was no longer eligible, which doesn't happen very often anymore. But then when she was on hospice the last time, we had the medical director, the social worker, we all had the same conversation. So everything was put in place to just allow her to die gracefully.
Excellent. Question, what is a do not transfer order?
It's an order that means they're not going to send her to the hospital. They're not going to send her to some other medical facility for some,
okay,
to try to cure.
Yeah, great. And thanks for Dixie for asking that question. We have a lot of providers on here and people that have gone through this, but questions like that are really important because a lot of the folks come to these discussions have never heard these terms. They're like you, it's sort of like just deep right into it. So one of the fabulous things about hospice for me was it allowed me to look at my mother's care in a structure of how do I fulfill her wishes, which she made painfully clear, and do so gracefully. And there was a time period where for a couple of weeks, and this is before she died, it was when she was on hospice the first time, and she wasn't doing so well initially, where we were making life and death decisions. And she's having internal bleeding, and if we do this, then that would happen. If we do this, then she might have another stroke. Well, what do you want to do? And those are tough conversations to have, but
the hospice folks really helped me through it, and without saying here's the right answer or the wrong answer, but it gave me a structure to think through, and that was enormously helpful in the final days as well.
Great. Well, as I'm looking at the clock, this is awesome. We got through just about all the questions, and I know you've got another call coming up. Any closing thoughts? I will make sure to post your links and everything on the recording at proaging.com. But this has been a great discussion, and I really appreciate you sharing your story with us.
Well, thank you for having me. I'll just close with, I think that, my book tries to cover sort of three things: how to be prepared, and how to get through it, and how to survive. And at the very end is, what do you do after someone's died? It didn't occur to me until my mother died. There are all these credit cards and bank accounts, and what do I do? And I think that it's really important for caregivers to be able to advocate and to do it without fear. And I hope that my book will help people do that.
I love it. Well, thank you so much. And thank you again to the audience for just some great thought-provoking questions. So we'll see everybody next week, and I'll get this recording up.
Great. Thank you so much.